never really thought about this until I read her this information. In today's world, kids always have something in their ear, headphones, the earbuds, whatever. Uh, didn't think about that and how rough that can be on hearing. Welcome. Good morning, doctor.
Good morning.
Now, why is it so important that we monitor our children and these noise and toys in the whole 9 yards?
Noise-induced hearing loss is 100% preventable. So if we don't pay attention to what our kids are listening to, then they're likely to end up with a hearing loss that it's treatable but can't be cured.
Mhm.
Right.
Yeah, that's a
Mhm.
right on. Go right ahead.
Well, even as an adult now, I've had headphones on my head daily for the last 25 years. So,
Absolutely.
Yeah.
I mean, there's dangers there as well. So you got to be careful to monitor the sound levels and make sure that you're not, exposing yourself to too much so you end up with a noise-induced hearing loss.
Doctor,
so how do we, as parents kind of prevent this for our kids and, leading them down this road of you've got to take those earbuds out every now and then?
Yeah, so I mean, I guess just teaching them early. If it sounds loud to you, it's definitely loud to them. When it comes to headphones, we like to talk about using, over-the-ear headphones as opposed to in-the-ear headphones. There's just a little bit less potential for noise-induced hearing loss there. We also like to use the 60-60 rule. So listening for 60 minutes at a time at a 60% volume level, which should be pretty safe, but then taking a break after that 60 minutes.
Doctor, besides the earbuds and all this other stuff, okay, I have this habit. I use an electric razor. And if you get those razors too close, that noise that can harm you too, can it not?
If it's loud enough, it's hard to say without measuring, that razor, but, every 3 decibels louder, halves the amount of time that you can be exposed to a sound. So 85 decibels is considered safe for about 8 hours. But, even just 83 decibels, we're down to, 4 hours. So every 3 decibels louder,
Wow.
halves the
Right.
amount of time that you can be safely exposed to that sound.
You talked
Wow.
about the dB level, 85%. How loud are some of these toys, and are kids more sensitive to the loud noises?
Sure. So kids are a little more sensitive to them. They have smaller ear canals, which makes the sound pressure level just a little bit higher. They're also, it's really more the impact, right? Because they're still learning language, a hearing loss for a child, the impact on their life is much greater. Where it's a nuisance as an adult to have a hearing loss, for a child, it actually can impact their ability to learn language. As far as how loud the toys are, I mean, to be fair, this is something that's regulated. They're measured, to be 85 decibels at about 1.5 feet away from the surface of the toy. But what we don't think about sometimes is the way the children use the toys. So they like to bring it up to their ears and listen to it,
Hmm.
closer. And that can really change the level of that sound greatly. So we recommend measuring the toys yourself. There are apps that you can download with sound level meters on them. So you can actually measure the level of those toys and just make sure that they're safe for them.
That takes me back to Super Bowls. You started seeing this about 5 or 10 years ago because of the huge crowds and the noises. When a player had his child on the field for the post game, they'd have headphones on. They'd have those
Right.
noise canceling headphones. And you don't think about it, but when you're in those early stages, you're developing, and that injury could result in long time issues with hearing.
Absolutely.
Uh,
Is
one, go ahead, Chuck.
I was just wanting to ask the doctor, is there a law that limits the amount of decibels something can put out for your safety?
Well, they are regulated. The Consumer Product Safety Commission makes
Okay.
sure that these toys are safe. But again, they're measuring these toys at about 1.5 feet from the surface of the toy, which means that we're safe. If held at arm's length, when the child brings it up closer to their ear, the sound level is quite different. So
In
we just
other,
need to monitor and make sure the kids aren't putting the toys up close to their ears. And there's some other things we can do. You can put tape over the speakers to bring the level down. I mean, there's a lot of other things you can do. But yes, it is regulated.
Let me ask you this. We've all talked about, we've worked in this industry for a while. Headphones are the norm, loud stuff in your ears. Through the military, now they have an emphasis on hearing protection. Back then, it was like, yeah, good luck with that. Uh, is there any way we can treat or help or maybe even cure a hearing loss?
So most hearing losses are not curable. They're treatable through hearing aids. Hearing aids are significantly better than they used to be. These aren't your grandfather's hearing aids. We have these really cool features. We can stream audio. We can there's heart rate monitor. There's health tracking. Hearing aids are pretty cool these days. But at the same time, if we can prevent that hearing loss from happening in the first place, that would be preferable.
So, what would you suggest when it comes to our kids now that there's earbuds, the loud toys? Loud toys have been around, Us parents secretly take the batteries
Yeah, I
out.
know it. Yeah.
But
It's broken.
oops.
Give me
How
my
often should we
batteries.
be having our kids checked?
We recommend it once a year. It's never too early to get your hearing tested. And we like to kind of relate this to an aging thing. I'll start getting my hearing tested as I get older. Hearing loss doesn't really care how old you are. It's really more about what you're exposed to. So here at Livingston, we recommend having your hearing tested once a year. You know, even as a child.
Wow.
Go ahead, Chuck.
Yeah, Doc, I know, well, I'm just 22 years old. I noticed that
In
I
dog
have,
years.
I got you, boy. I've noticed, I've noticed that I have a terrible tendency to say, what? What did you say? And sometimes I'm wondering, am I really suffering from hearing loss, or is that I'm trying to tune out somebody else to hear, like
You
David sometimes. But I guess as you get older, you do have a tendency to lose hearing through natural attrition, correct?
That's true. And it's funny you mentioned that. We hear this a lot. The person with the hearing loss is usually the last one to know. Your family members are probably going to tell you, or the TV's turned up louder than it should be, or you're having to ask people to repeat. It's because usually the frequencies of hearing that we lose first, or the higher frequencies, they're the
Right.
ones that give speech clarity. So you may hear fine, but may just not understand all of the words. And that's usually a good sign at kind of beginning stages of hearing loss. I would highly recommend that you have your hearing tested just to make sure.
Uh, right now with the pandemic and the mask mandate, I find myself finding it harder because I did realize how much I was using visual clues to listen to someone
Right.
rather than just my ears. So that's been a struggle for everybody of any age. Uh,
Absolutely. The masks actually have shown a lot of people, kind of a mild hearing loss where they didn't really think they had a hearing loss before. But now, without visual cues, we read lips more than we think we do. And then also because the mask actually acts as a filter,
mm,
it kind of cuts some of those higher frequencies, which help us with speech understanding. So we're starting to see a lot more of those high frequency, kind of mild hearing losses coming in, mainly because of the masks.
come in. Now, doctor, I see all the time now on TV they advertise these over-the-counter hearing aids or these
Right.
call in, and if you want a second pair, just pay the shipping and those sort of things. How are they comparable to, like you said, the new age and new wave of hearing aids?
Yeah, currently there are not any hearing aids that are over the counter. Most of these are going to be more like an amplifier.
Hmm.
These are more likely to make it louder, but not necessarily clearer. They're not prescribed to your particular hearing loss. So they're designed for a mild hearing loss. I'm not going to say that they don't help. They're definitely not as sophisticated. They don't have the same noise reduction features that an actual hearing aid would have. An actual hearing aid would be programmed specifically to your hearing loss based on the frequencies where you have difficulty. So where again they could be a help. They're definitely not the equivalent to what you would find through an audiologist.
Under under the best circumstances, uh, you gave us the parameters of how much noise we can take. Are there, just out of curiosity, are there places in the country that are quieter than some other places, to your knowledge? I mean,
I'm
like,
sure there I'm sure there are. I mean, I would think any kind of city type of area, is going to have more traffic noise, more just noise exposure in general. I don't know off the top of my head specific locations that would be quieter than
well, I
other
mean,
countries or whatnot.
like, let's face it. If you stand 10 feet away from a jackhammer that's loud, and you know, uh, I was just wondering if there was a way I could save what little bit of hearing I have. Is there a perfect place
Out
for
to the
me to
country.
move? Yeah. Is there the perfect place for me to move? That's all I was basically getting at.
Yeah,
So I can't.
but it's a good point. Hearing loss really is more about what we're exposed to than it is, that we're getting older. It's accumulation of noise exposure over time. So if you stand next to a jackhammer, that's kind of adding up,
Right.
over your lifetime. It depends on how often you're exposed to that jackhammer. That's going to, determine how much hearing loss results from that.
All right, Dr. Owen, we have to remember the 60-60 rule. Listening for no more than 60 minutes at 60% volume is considered a good way to handle these noises. If you have any questions, you can contact Dr. Owen. She's with the Livingston Hearing Aid Center right here in Amarillo, Texas. Thank you, Doctor, for taking time out and spending it here on the chat with us.
Thank you.
All right. Have a great day and Merry Christmas.
Merry Christmas.